Africa CDC for inviting us to be here to co-host this critical meeting on the margins of the 78th session of the United Nations General Assembly. In the same way as we responded to COVID-19, Africa's pandemic prevention, preparedness, and response efforts should be defined by unity, solidarity, and coherence. I was saying earlier to the colleagues who sit on the commission that we set up that, as far as I know, we in Africa are possibly the only continent that succeeded and managed to develop a clear strategy on how to respond to COVID. A well-articulated strategy, well-developed strategy that enabled our continent in more ways than one to navigate its way through COVID. Likewise, Africa should set its own agenda to fit into global plans. Africa is justified in wanting to have self-reliance in pandemic preparation, pandemic prevention and response, or as we can say, PPPR. Now, Africa's experiences over 100 infectious diseases that have broken out quite often in a year, most of which we have managed to contain. During COVID-19, Africa emerged as a leader in genomic surveillance. On 2 occasions, we were the first to alert the world to new COVID-19 variants. The relative success of Africa's COVID-19 response strategy should be studied and be clearly documented as well. We need to understand the effect of factors such as the high degree of cross-border cooperation, local expertise, and that needs to be forged. These learnings can form the basis of an informed, proactive strategy. Together, we build a solid foundation for PPPR by doing a number of things, but particularly by strengthening our public response institutions. We initiated a pharmaceutical manufacturing strategy. We established procurement as well as expose African products to the global market through the African Medical Supplies Platform. And I often that if there ever was a moment when our continent really showed positive signs of integration in practical terms, going just beyond talking about integration, it was during the COVID pandemic, because there came a time when we needed personal protective equipment, and we were the one continent that manufacturing base for our PPEs, and we had to scurry around the world trying to acquire PPEs, and the prices were being hiked for profit taking. And it was at that time that we decided, and it's a pity Strive Masiiwa is not here, where we decided that we would set up a facility, or rather a platform, which would enable the whole continent to be able to acquire personal protective equipment at a cost-effective level. In the middle of nights and so on, talking across various countries and leaders of various countries, we were able to set up this platform and acquire personal protective equipment that we were then able to ensure they are distributed throughout our continent. And following on that experience, we were also able to set up the Africa Medical Supplies Platform, which too was a phenomenal success. We also focus on economic recovery issues. Our special envoys helped to raise $200 million in special drawing rights for the continent and negotiated that our member states be prioritized for access to those funds. We have a window of opportunity to maintain political will and investor interest to drive significant investment towards developing regional PPPR capacity. We need to focus on a few critical areas. Firstly, we need strong, sustainable, digitally empowered primary healthcare systems, and we need community response national public health institutes. And because outbreaks happen at the community level, information must travel faster than the pathogen. Health services must be able to reach vulnerable groups on our continent, including those that are in conflict situations. Secondly, we need real-time surveillance and good cross-border cooperation across our various countries on the continent. And thirdly, we need a capable and fit-for-purpose workforce. We need to urgently establish the Health Workforce Task Team to operationalize health workforce development. With such a large youth population, Africa can be the hub of health workforce production to close the global health workforce shortage that we currently have. Fourthly, we need equitable access to medical countermeasures, including vaccines, therapeutics, diagnostics, and through local manufacturing and functional last-mile delivery of goods and services. And fifthly, we need predictable financing for pandemic prevention, preparedness, and response systems. Now, the Bureau of the Heads of States and Government have agreed to establish the Africa Epidemic Fund. We need to swiftly conclude the necessary statutory processes that are necessary in terms of our statutes and replenish the fund. As the AU COVID-19 champion, I have tabled a proposal to establish a regional legal instrument as a PPPR cooperative mandate that would be triggered by a declaration of a public health emergency of continental security or international concern. This legal instrument should in the end outline the actions that member states can collectively take and appropriate modalities for the region's interaction with the world during the next pandemic. We all should be alive to the fact that there will be another pandemic, and we therefore need to be well prepared for the next pandemic that is going to hit us all. Pandemic preparedness requires that we achieve our ambitious manufacturing goals. This needs to be a collaborative effort that brings together the Africa CDC, the Partnership for African Vaccine Manufacturing, the AUDA NEPAD, and the Africa Continental Free Trade Area Secretariat, with other relevant continental and global partners, as well as the private sector. We need more investment into research and development, building on our diversified clinical trial expertise and drawing from indigenous knowledge systems that exist on our continent. We must encourage the co-development of products to secure ownership of intellectual property, which is a critical matter over which we are now involved in a tussle at the World Trade Organization with Global North. The high-level working group on health manufacturing was established to coordinate and monitor the impact of such partnerships. The working group will also monitor the progress made by large procurers of health products like Gavi, UNICEF, PEPFAR, as well as the Global Fund. This follows the Bureau's call for these procurers to purchase at least, as was said earlier, 30% of the products destined for Africa from African manufacturers. And this is a matter that all of us should really feel strongly about, because we're a continent of 1.4 billion people, and much of the medicines and the vaccines that we get are imported from outside of our continent. And this is a matter that we need very strong voices on, and insistence that at the very least 30% should be procured from African manufacturers. Now, we're often told that no, Africa does not have the capacity, particularly the manufacturing capacity, and that we should continue relying on those who have the capacity. And I say, no, that is not true, even if we don't currently have it all on an overall basis on our continent. The opportunity needs to be made available for many countries on our continent to develop that capacity. Because if that opportunity or the market possibility is not developed or made available, we will never be able to develop that capacity. Now, as we build our regional capacity, we must also position ourselves prominently in the global PPPR negotiations. We need a unified voice, as well as demonstrate that we have common positions to advance the interests of our continent, but more particularly the people who live on our beloved continent, Africa. Africa needs to be well represented in key global forums, like the World Health Organization's consultative process towards an interim medical countermeasures coordination mechanism, the G20 as part of the AU's new membership, the G7 MCM delivery partnership, and the informal Johannesburg process. Now, South Africa, as co-chair of Access to COVID-19 Tools Accelerator, or ACT-A as we call it, and there is much we can do to learn from the experience of that initiative. We concur with the ACT-A external evaluation findings that it was not a perfect instrument, and in the end did fall short of attaining the equity that we required. It did not contribute as effectively as it could have to the last mile delivery and strengthening of health systems. However, Act A did establish solid collaborative networks that together were able to raise $24 billion in financing, delivered 1.96 billion vaccine doses to low and middle income countries, and procured over $700 million worth of personal protective equipment for health workers on our continent. We can build on this collective capacity whilst addressing the weaknesses as well as the mistakes of the past. The combination of climate change and the increased movement of people has caused an increase in the frequency of outbreaks worldwide. This means preparation is urgent, and in the end will not wait for us to make up our minds at the intergovernmental negotiating body. It is for this reason that we support the establishment of an interim medical countermeasures coordinating mechanism. However, it must correct the mistakes of Act A and be founded on a firm principle of accountability and fair governance characterized by a partnership of equals. Gone are the days when Africa should be relegated to the back, and gone are the days when Africa will tolerate being treated as an unequal partner. We will not allow that going forward. We support the WHO consultative process towards establishing this mechanism, and that it should align with the determination of the intergovernmental negotiating body. It is heartening that BRICS and some AU member states, along with the AU specialized agencies, partners, and the private sector, came together on the margins of the recent BRICS summit that was held in Johannesburg to discuss a possible collaborative framework between our respective nations. The BRICS group of countries has enormous health information and biotechnology capacity that can be leveraged for Africa's manufacturing as well as for our pandemic preparedness and prevention response ambitions. The deliberations and determinations of this meeting are therefore extremely important, as they will form the basis of our contribution at the upcoming African Union Summit. I look forward to the ideas that will be put forward today, and also for guidance that a number of you can put forward. I thank you for attending this important meeting. Thank you.